How are you doing, guys?
Good. How are you?
I have a cold.
Oh no.
So I might be
Same
sounding
here.
I might be sounding a little bit like I'm reading the trailer of a new Die Hard movie, but we'll see how that goes.
Yeah, people always find me more sexy when I have a cold.
Yeah, don't flatter yourself too much. Anyways, together we will be amplifying the healthusiasm that we see in articles, new business ventures, or simply even in the world around us. This is the fourth episode of the second season, and in this show we will discuss how to set up telehealth for success and whether healthcare as a product is something, nothing, or everything. But first, some health enthusiasms, some positive changes that will impact our health and happiness, and that the Health Enthusiasm panel wants to inspire you with. Aditi, what is your health enthusiasm this month?
Yeah, so this month it was actually a story that I read that I just found interesting, whether I'm enthusiastic about it 100%. But basically, there was a model out in a rural area in the US, which, like many other places, is a medical desert. There aren't many hospitals or clinics or physicians who work there. And so they modeled out trying to, instead of hire more physicians or try to hire more people to go there, they wanted to pay more to the cardiologists who were already there and see if they could incentivize them to spend more time in those rural areas. And to no one's surprise, it actually worked. I mean, if you look at all of the research in behavioral economics and nudge and all of these things, that works. Financial incentives work. What I thought was surprising about it is that somebody actually tried that. Like many other places, there's been an entire change in our workforce, how we're paying for things. People are getting paid less for seeing more patients. And so the fact that they even took a chance to pay more was really what surprised me. I think it makes a big difference both to physicians and to the patients because they can actually have somebody in person, they have the specialist in person, and then you don't need to hire or wait for more doctors to be trained. You can actually just bring them in. So we'll see if they do anything more than this. I don't necessarily think so. I think this is just going to be one of those things that we know is true, we've now proven is true, but may not actually follow and be paid for because it's more expensive. Not in the long run, but it feels more expensive. But I did find it interesting that somebody did try it, and to no surprise, it worked.
Okay. Super interesting. I remember we once had a discussion on incentivizing patients. And I think in the discussion, one of the things that came up was that probably incentivizing with money might not be sustainable over time. First of all, because it might be difficult to keep on getting the funds for it, but also that maybe financial incentives might not, always be that motivating over time. Do you think that might play a role here as well? That maybe physicians wouldn't be incentivized by those, financial incentives?
I think in general, it'll come to a point where there'll always be someone who could be financially incentivized to move or do some of those
Oh yeah.
things. But of course, as you get further on in your career or it becomes more impractical with whatever else is going on in your life, let's say you have older children or you have children or you have to be in a certain area, it may not work as well. But I think that it will work in general because unlike patients, which are dealing with their own individual health, when you're paying clinicians more, paying these doctors more, that's their job. So one of the incentives is financial. And
Oh
so it
yeah.
makes sense that it may continue.
Okay, Mo.
Yeah, I totally agree with that, DT. And from a behavioral psychology point of view, financial incentives work when the effort is low, or the task is simple. For a cardiologist to stay where he is and just do what he or she is already
The same
doing
job.
is simple. But if you ask a patient to do things that are more complex, financial incentives do not work anymore. If you look at people working at plants and you say we make 100 today, we need to make 120 tomorrow, you give the financial incentive, that works. But if you ask a consultant to bring more business in and it's more complex, then the incentives do not work. So I totally agree with Aditi. The task is quite simple, it is convenient, and I think the incentive will work.
Lovely, lovely. Let's stay in the States. Let's go to some retailers. Best Buy, which if you're from Europe, you might not be 100% familiar with, but it's an American multinational consumer electronics retailer. A bit similar to what we know in Europe as Dixon's or Fnac or Coolblue, Media Market maybe, or if you're listening from Asia, JD or Suning might come to mind. Well, Best Buy Health is now partnering up again with a hospital. In this case, it was Mass General Brigham hospitals. And so what they will do is they will provide their technology that they have available, Best Buy. They will provide their technology to help with more human-centered and even omnichannel logistics to scale and support the home care offering by these hospitals. So they will be providing remote patient monitoring platforms, which Best Buy bought last year, called Current Health. And then also some personal emergency response devices called Lively. And as I said, this is not the first time they're doing it. They already have a collaboration with NC-based Atrium Health. So I find this really interesting, and like a retailer, a consumer electronic retailer, partnering up with hospitals. We haven't seen that, I think, in Europe. And so I'm really curious to see when a Fnac or a Media Market or a Dixon's might be stepping into this field as well. Mo, what Healthusiasm did you see or hear in previous months?
Well, I have a mischievous smile on my face because we've been taught a lesson about arrogance and complacency by women again. So it's about two powerhouse researchers, Dr. Natalie Ozympic and Sarah Lucy, who just dropped not really a bombshell, but something interesting again about women, how they're underestimated. It seems that in prehistoric times, they were not just gathering, the cliche that women were gathering and the men were hunting has been completely destroyed. They were hunting and they were darn good at it. In the latest studies, they're rewriting history. They're correcting the history that erased women from the hunting narrative. So imagine this: prehistoric women were just bystanders. They were out there on the front lines, getting injured, hunting like ultimate badasses. And now let's go into nitty-gritty of the OG hunters. Why were they hunting? It's about they were just better at it. If you look at the female body, it's a powerhouse for endurance. And Dr. Ochobok breaks it down. Estrogen and another hormone, adiponectin, these two cool hormones were the secret sauce making prehistoric ladies the marathon runners of their time. And estrogen is not just about fat metabolism. It's also the unsung hero of life. It protected cells during intense activities. It played a crucial role in cardiovascular health, brain development, and injury recovery. And there's the adiponectin, another hero, keeping muscles in top shape. So there's proof. There's proof because from Peru, ancient women were buried with their hunting gear, and you don't bury something with something unless it's really important. So forget about the idea that women took a break from hunting during pregnancy or while carrying kids. It just didn't happen. So why do I find this important? Because this is what we do. It's about the arrogance of us interpreting what happened in the past with the view that we have today and thinking that all we know today is absolutely true. So I love that. And that is what Healthusiasm is also about. It's about, breaking barriers and rewriting the narrative, one episode at a time.
Lovely. Some nice insights there. I wasn't aware of that. Going from one arrogance to another, I'm trying to make a bridge here. It's not a nice one. I'm going to the tech industry. But let's have a look at what happened with ChatGPT and OpenAI. And I won't go too much into the detail of the saga that's been happening in recent weeks. If you're not aware of what happened, Sam Altman, the CEO, was fired as CEO of OpenAI. He was fired by the board only a couple of days after their first Open Dev Day. Funnily enough, Microsoft, which is one of the most important investors of OpenAI, they immediately offered them a job. And that was only the beginning of the saga, because a couple of days later, other people from the C-suite decided to leave OpenAI. And I think even the newly appointed CEO decided, I don't want to do this. I'm out of here. And then in the next few days, 600 of the 700 employees wrote a letter to the board saying that they'll quit if that board stays on. Anyway, I might have missed a couple of entanglements or plot twists along the way here, but that is pretty much what happened in less than a week time. But that's not why I wanted to bring this up. because I actually wanted to talk about what happened during the Open Dev Day that ChatGPT has done or held a couple of days before this whole saga thing. And this Open Dev Day was really felt to me like the launch of the iPhone in 2007. I mean, there were a lot of improvements related to GPT and DALL-E. That was nice. But mainly they announced the GPT store, which is basically a store where you can store but also sell the GPTs that you'll be making. And that was some really nice news. It was kind of expected, but it really was nice. Because it means that you can now build your own ChatGPT. And that was expected, but it wasn't expected that it was that easily to build. I even tried it a little bit myself. And so what it really comes down to is that you can very easily upload information into your own ChatGPT, your GPT platform, so that people can more easily find that information or even interact with that information in a way. So more concretely, for example, I could upload my book, the transcripts from this podcast, the videos, my keynotes, my newsletters, my articles, so that people can actually go to something like a Healthusiasm GPT, if you will, and then ask questions about it to interact with that information. And I think this is super interesting and super relevant in healthcare, because if you think about it, there's about 1 billion health-related queries, searches on Google every day. 1 billion. So people are looking a lot for health-related information. It's about 7% of the entire Google queries that go on. And so you can imagine that companies like WebMD or any website that currently has a ton of information that are consulted via Google, that they could easily start building their own GPT, and that you can actually ask questions to the WebMD, chatbot to have more concrete information available. And I think that will be super relevant, because you can imagine that patient organizations or hospitals or pharma companies, that they could all, with all that information that they have at their availability, that they could all upload this into their own GPT, so that the patient can actually more easily find those awareness, educational programs in the future. Because all those information will be in some sort of interactive chatbot to be found. And of course, I'm not talking about diagnostics. I'm not talking about clinical support. That will come as well sooner or later. But it's not really for the near future, I think, although things are moving that fast. But I'm more talking about, the general health information that right now can be found online. And I think that, every health organization should be starting to play with this, because GPTs, or, large language models in general, will be the front door of every health organization. And I really liked it. It's a little bit futuristic. I'm thinking about what could happen, but I really think when I saw that news coming in, that announcement, I was like, whoa, with the interest in health information, this could be a major change in how we access information. And I'm not talking about within 5 years. I'm thinking about within 1 or 2 years. So quite a big change, if you ask me. Now, to round up this Healthusiasms, I always have a couple of weird ones, which I will use to quiz you on. I have about 3. So here you go. Feel free to let me know what you think this is about. First one is about Lifetime Fitness. They will start a pilot program. And my question to you is, what is so special about it? And there's a small hint I'd love to give you, is that we talked about it before on this podcast. Why is this pilot program so special by Lifetime Fitness?
You don't have to get out of bed to fitness.
That would be a great one. But this is not something we talked about previously, right? It was a concrete topic in
Was it music driven? We did something with music and behavior.
No. I'll give the answer away. It has to do with the miracle weight loss jab, Ozympic. So it's a general fitness, but what they will do is they will bring in medical professionals in-house to deliver the obesity drugs to their members. And the program will include blood tests. It will meet FDA guidelines, but it is to attract people and make sure that they comply with the physical activity and perhaps even lose some weight along the way.
Well, this is so ironical, where home delivery used to be the problem in food ordering or sedentary lifestyle. You don't even have to get out of the house to lose weight. So that's really interesting. Yeah.
A second one, there's a new watch on the market that is supposedly good for your health. But what is so special about the watch? I won't be given any hints here. A watch that is good for your health. Aditi, any thoughts?
No, unless it's like being able to actually not just get your health data, but also give you feedback on what to do next.
No, not really. Mo, what do you think?
I think it needs to be good at nudging something, but I don't know exactly why.
Yeah, cool. Yeah, comes close indeed. Well, it actually doesn't show time. So it's a watch that does. We're too consumed with time. We're too obsessed with time, and so what it only does, it gives you nudges, and you can say at what intervals. It could be 15, 30, 45, or 60 minutes, and the only thing that will do is just gently nudge you of the fact that another 15 minutes has passed, another 60 minutes has passed, and the idea is that you are less obsessed with how late is it, but that you're more aware of what is happening, that you're more in the moment, and that is kind of like how they would love to get you away of being obsessed by time, just being obsessed by how late it is, let's say. But it's more about mindfulness. That's basically what they try to achieve. I'm not quite sure whether it'll ever fly. I think it was.
Well, I think if it integrates across your entire ecosystem of devices, because the times that I look at my watch for time is inferior to the times that I look at time on the laptop or anything else. So I think if it's a service that integrates across your entire ecosystem, it might work.
Yeah, fully agree there. And the third one is also integrated in the entire ecosystem. It's a pendant. So we're staying in the wearable space. It's called the Rewind Pendant. And it is said to help peace of mind and also helps to be more present. And why I put this up, because when I first saw it, I was like, what? This is ridiculous. But it was endorsed by Mark Andreessen, the big venture capitalist and famous venture capitalist from A16Z. And it was also endorsed by Sam Altman by OpenAI, saying this is probably the future for personalized AI. What does the pendant do?
I actually know the answer, so I'm not going to guess.
Please go ahead, because I blank out, Aditi.
Yeah, so it actually records what you're saying so that it can actually send it to your phone.
Exactly.
This whole ambient communications and ambient AI.
Yeah, so it really records everything that has been said around you, and it's transcribed to your phone. So basically, you'll never have an argument with your life partner about who has said what, or if you forgot something you need to pick up from the grocery store, it is recorded. So it can automatically make a to-do list for you. I'm not quite sure. It looks great. It's not that big. It's a very nice, cool shape. But I mean, that's a ton of data, and it's like privacy-wise, and which is a recurring topic in these kind of things. I was pretty shocked by it. But indeed, it records everything that has been said, your entire environment.
I mean, there's an entire group of articles where you can use this for health data, right? So if you're a physician and you're with your patient, using AI to gather the information so it goes into your medical record is one of the use cases people talk about, but
totally,
you have to tell everybody about it. Now, that's okay if you're in a closed environment like a clinic room, but if you're in public and people are just speaking, what's your responsibility to tell everybody that you're recording them? Like, how do you do that, right? If you're in a busy, cafe, you like when you just announce it to everybody, it's just not practical then. But people may not like to be recorded. I certainly wouldn't.
No, sure. It's a weird thing. But yeah, this is where we're heading. Anyways, thank you for all these Healthusiasms. It is a Healthusiasm world indeed, and there's a lot of positive changes that are making our world a little healthier and happier every day.